When it comes to trying to solve the issue of slow clinical trial enrollment, we've all been guilty of this genius's definition. Even with proven patient recruitment services available, trial sponsors cling to the same customary approaches, often lamenting that patient recruitment is just too expensive. But compared to what? The comparative options, namely adding more sites and more time, are viewed as safe, well-trodden paths. A more common misconception is that they are less costly and even free. In many cases, they are more expensive, and they are never free.
The best way to approach a shortfall in enrolled patients for a clinical trial is to truly understand your options. Historically, your options have been to add time or add sites to your trial in order to make up the patient shortfall, but now there's a realistic third option in the form of patient recruitment that can address those gaps for the same or less money.
Over the last 6 or 7 years, the most consistent thing I hear is, wow, patient recruitment is expensive. And my answer is, compared to what? Compared to adding more sites, compared to adding more time, or a combination of the two? I think you'll find that it's very, very cost effective in many instances if you make that comparison. Compared to nothing, but nothing isn't an option.
Let's examine how one company, Acurian, is breaking through conditioned behaviors to give trial sponsors what they need: cost-efficient solutions for completing enrollment on time. In return, you will learn how to objectively evaluate your options and avoid the most egregious but solvable dilemma within the clinical development continuum.
The CROs, while ultimately responsible, don't have the expertise outside of hoping that their sites will contribute the patients that the trial needs, and everybody knows that that doesn't happen most of the time.
Let's look at just a few examples of comparative costs for real and recent clinical trials. Acurian used industry-standard clinical budgeting tools from TTC IMS to derive costs, and it encourages sponsors to conduct the same objective evaluation for their own studies. In the first example, a Phase 3 trial for irritable bowel syndrome, the sponsor could have spent an extra $7 million, adding enough sites to bring in a projected shortfall of randomized patients. Or it could have extended enrollment and hoped for sites to find the necessary patients. Based on the study's current site enrollment rate, or SER, of 0.244 patients per site per month, extending enrollment would have taken over 3 months to complete at a cost of $5.2 million. Instead, the sponsor used Acurian recruitment services to realize a higher site enrollment rate, saving at least $3 million compared to the next best cost option. Importantly, sites randomized these Acurian-sourced patients in just over 2 months. Timing, along with cost, was critical as this sponsor was in a foot race with several other companies also in Phase 3.
The point of doing cost analyses is to help the sponsor understand truly on an apples-to-apples basis what their patient recruitment options are. So if you put the CRO's cost for additional sites and time together with a patient recruitment company, they really can make an informed choice.
5 years ago, nobody had the evidence to show that it could be done predictably, repeatedly, and consistently. It was more of a risk. You spent your money, sometimes it worked, sometimes it didn't work. That's over. Acurian can do it consistently, repeatedly, and efficiently. The real question that's left is it cost effective versus the other options I have?
In this next example, a cardiovascular outcomes megatrial had been enrolling for over 6 years and was still projected to run over 2 years later than planned due to insufficient enrollment. In a single year, Acurian services increased the patient enrollment rate by 343%, which was 29% faster than waiting to see what the sites could do. Not surprisingly, for a trial of this magnitude, the cost and time savings of selecting the Acurian option were dramatic. Had the sponsor waited for sites to try and continue enrolling from their own databases or efforts, it would have taken at least 2 more years at a TTC estimated cost of over $119 million. Compared to the cost of using Acurian, the sponsor saved over $107 million and a minimum of 2 years. These case studies are not at all unusual for Acurian, which has produced similar results in over 50 therapeutic indications.
We can absolutely provide concrete proof through case studies and other analysis to show and demonstrate that patient recruitment is an absolutely cost-effective third option to adding sites or adding time.
We would absolutely welcome the opportunity to provide a cost analysis to any customer or potential customer that wants to gather some information about potential cost effectiveness of the Acurian solution versus adding more sites, adding more time, or the combination of the two.
So, if you are running a clinical trial, you'll find it hard to ignore Acurian's cost-effective solutions for lagging enrollment, fewer sites, more patients per site, at a cost per randomized patient that is unmatched in the industry.
I would encourage sponsors of the patient shortfall to understand their options and understand the cost and time implications associated with those options. And if they do that, and we can help them do that, they're really going to make the best decision for their trial.
We hope to demonstrate to you that in a very significant majority of the cases, not only is centralized recruitment from Acurian a good option, it's the best option and the most cost-effective option.